Hi everyone, Dr. Sean here. Sometimes when I go to TJ Maxx, I suddenly feel like I need to use the bathroom. It's strange, but I looked it up. And there's actually phenomena like this. It's called Mariko Aoki phenomena. People often feel the urge to use the restroom when they go to places like Barnes& Nobles. Personally, I find TJ Maxx more comfortable than Barnes& Nobles, I guess. According to research from the nutrition department at King's College in the UK, using this method increased the frequency of bowel movement by 3 times more per week and is more effective than a constipation medicine, which is only increased by 2.5 times more per week. What do you think this method is? Usually, when it comes to dealing with the constipation, the first thing people do is to go to CVS and buy something like stool softener. How did it work for you? If it worked, well, you're probably not watching this video right now, right? So, what's the best way then? Healthy eating and regular exercise are most ideal method, but I know they're not always easy to follow. That's why I'm here to provide a truly practical solution for those of you who are suffering from constipation. At the end, I will even tell you what constipation patients should absolutely avoid. So if you don't have time to see both, make sure to confirm at least one. If you're not in a hurry, I would appreciate it if you could watch both. Constipation is not an illness but a symptom, so identifying the underlying cause is important. Constipation refers to a situation where stool stays in the colon for an extended period, leading to excessive water loss. While diagnostic criteria may vary, constipation typically diagnosed when there is a difficulty in passing stool or feeling being bloated, rather than just based on the frequency of bowel movements. In simple terms, if you personally feel like you have a constipation, that's what it is. Even if you can have a bowel movement for a whole week, but if you're not uncomfortable, it's not constipation. So if you feel uncomfortable, you're in the right place. I'm going to share 3 solutions right now. Let's go. The first one is changing your sitting position while using the toilet. Have you ever heard of a poop stool? It may not sound like much, but it's really effective. Many people with constipation have a bent angle between the rectum and the anus, which prevents them from having a proper bowel movement. For those of you in this situation, using a poop stool can help align the rectum and anus, making it easier for stools to come out. If you need to use a public restroom, simply do a tippy toe. In addition to physical posture while using a toilet, your mental attitude is also important. When you're stressed out about constipation, it can create a cycle of anxiety that causes your body to tense up, making it even harder for stool to come out. You don't have to go to the bathroom for bowel movement every day. You should only go when you receive a signal from your body. Even if you've been thinking that it's time to go because it's been a while or your stomach feels uncomfortable, if there's no direct signal, it means your stool haven't reached to the rectum yet. Stool is still in the sigmoid colon, the S-shaped part of the colon. If you try to force it at this point, it can put unnecessary strain on your body. Moreover, if nothing comes out, it can actually increase stress. That's why you shouldn't go to the bathroom until you receive a clear signal. And even if you do go, if you've been sitting for 5 minutes without any success, don't hesitate to get up and leave. The urge will return later, and you can try it again when it does. To ensure good bowel movement, it's not just about physical posture, but also your mental attitude is important. While waiting for the signal, please massage the area shown in the picture. It's located about 3 finger wide to the side of your navel and about 4 finger wide below it. These are acupuncture points that can help with the constipation. Continue massaging here for about 5 to 10 minutes. The second method is to increase your fiber intake. This is one of the most conventional ways to address constipation. Constipation occurs when stool become hard and difficult to pass because too much moisture is drawn out of it in the colon, right? However, just drinking more water isn't going to cut it because a lot of that water gets absorbed by your kidney and end up as urine before it even reaches to your colon. In simple terms, getting water to the colon is not as easy as it sounds. And that's common reason for constipation. Fiber not only soak up the water that can be sent to the colon, but also helps to speed up the time it takes for your stool to pass through the colon, which ultimately helps to improve constipation. However, there are four critical points to pay attention here. This is most important part, so feel free to rewind the video or take notes. It's essential that you have a solid understanding of this information to apply it effectively. First, you need to find the fiber that suits you. Everyone's body is different, which means that what works as a fiber source to relieve constipation can vary from person to person. You should experiment with the various food-enriched fiber to discover what works the best for your body. One quick question. Do people with a warm colon tend to suffer from constipation more, or is it those with the cold colon? Take a moment to think about it. I will give you 3 seconds. 1, 2, 3. The correct answer is people with a warm colon. But if you got it wrong, that's okay. Just subscribe to the channel. Even ice melts and become warm once it enters our stomach. When we talk about the characteristic of a food being cold or warm, we're not referring to actual temperature. Most foods have inherent characteristics. Let me give you an example. Sushi, which we all enjoy, has a cold characteristic. However, when we eat sushi, what comes with it? Ginger, right? Ginger has a hot characteristic. When cold and hot nature meet, they become neutral. So, to prevent any upset stomach or discomfort due to cold food, sushi, they serve you with ginger and hot tea. If you often feel hot or have consistently dry skin, kiwi, a fiber with the cooling property, may be better fit for your warm colon. To get the full benefit of kiwi, you have to eat about 6 of them, but if that's a bit of tough, you can just take this supplement instead. Secondly, you should drink plenty of water. You see, fiber has this quality of absorbing water, so if you have fiber without drinking enough water, it can actually make the undigested fiber become hard and potentially worsen your constipation. That's why when you're eating fiber-rich foods, it's important to make sure you drink more water. Around 1.5 to 2 liter a day should do it. Also, the morning time is when your colon should be most active after a night's rest. Having a glass of water right after you wake up can wake up your colon to start being active, making it easier to feel the urge to have a bowel movement. Thirdly, you should avoid trying to find a quick fix. Some type of fiber may not agree with your body and can make your gut uncomfortable, even causing diarrhea and forcing a bowel movement. While you might temporarily feel relief by successfully having a bowel movement like this, if this becomes a repeating pattern, it can continually stimulate your intestine, leading to gradually declining in long-term intestinal function. Fourthly, when you start consuming fiber, it's important not to be too ambitious and begin with a small amount. Fiber doesn't get digested easily once it's in your stomach, so it stays in your digestive system for a while, increasing the volume of a stool and making it easier to pass. However, due to its resistant nature to digestion, it can also cause discomfort in your stomach. Undigested fiber in the intestine can interfere with the intestinal movement and even lead to cramping. These side effects can be more uncomfortable than constipation itself. So, don't rush to consume a large amount of fiber all at once. It's best to start with a small quantity, divide it among your meals, and gradually increase it as needed. The third way to tackle constipation is psyllium husk. The research I mentioned at the beginning of the video, where it proved to be more effective than constipation medicine, was all about psyllium husk. Psyllium husk is in fact the most practical and likely to be effective among the methods that I've talked about today. Among all the fiber out there, psyllium husk is known to work best for the relieving constipation. Unlike other constipation medications, psyllium husk doesn't get absorbed into your body. Instead, it acts in a way that's very similar to how your body naturally works, by promoting bowel movements. That's why, even in clinic, it's recommended as a first choice for constipation treatment. Also, since psyllium husk is a type of fiber, it's important to drink more water than usual when you take it. Psyllium husk contains a type of fiber that softens the stool, reducing the risk of anal fissure caused by hard stool. This makes it effective not only for relieving constipation, but also for improving the common problem of hemorrhoid that often occur in constipation sufferers. The truth is, while it's best to naturally get enough fiber through your regular diet, it's not always easy to achieve. So, if you find it challenging to get some sufficient fiber from food alone, I suggest considering the psyllium husk supplement. Psyllium husks tend to have a fewer side effects compared to other constipation medication or related supplements. However, keep in mind that individual reaction can vary, and some people might experience side effects like abdominal discomfort or diarrhea. For those who already have a sensitive digestive system, it's wise to start with a very small amount or consult with your healthcare professional before taking psyllium husk or any other fiber supplement. But did you know, folks, that there are cases where the action taken by constipation patients to relieve their constipation can actually make it worse? Sadly, there are far too many people who are already suffering and resort to worst case method. I hope that you too are not engaging in these two actions that should absolutely be avoided. Please pay close attention. The first one is the long-term use of a stimulant laxative. Medication like Darcolex or Sinocut are known as a stimulant laxative. This medicine directly stimulates the intestinal lining to force bowel movement. They are potent and work quickly, often producing results within a few hours, which is an advantage. However, using them for more than a week or long term can lead to problems. In such cases, the movement of the colon gradually becomes sluggish, making it impossible to have a normal bowel movements without medicine. And this might even require surgical intervention to remove part of the colon. Stimulant laxatives are originally designed for short-term use, so they should be only used in case of extreme emergency. The second one is frequent enemas. Administering an enema directly through the rectum into colon can produce results much faster than stimulant laxative. However, these enemas come with more severe side effects. Habitual use of enemas can lead to a decline in the function of rectal muscles and colon, potentially causing more significant problems. Reduced rectal sphincter function can lead to fecal incontinence. Damage to the intestinal lining can cause rectal bleeding. And in severe cases, excessive enema use can result in thinning and even perforation of intestinal lining, leading to intestinal perforation. Intestinal perforation can progress to peritonitis or sepsis, which can be life-threatening. Stimulant laxative and enema are meant for short-term use in case of acute and severe constipation. If you are a chronic constipation sufferer who find yourself needing this method daily, it's crucial not to rely on them alone and instead seek immediate medical attention. And if you tried everything and nothing works, now you know where to go, right? Yes, it's the Eastern Medicine Clinic. Eastern Medicine has a long history of effective treating even severe cases of constipation. Please consider it as an option. And if you know someone struggling with the constipation around you, please share this video with them. Thank you for watching this long video. Until next time, stay healthy.